What is the hidden trap of a zero premium Medicare Advantage plan? Well, if you're watching any television at all or open up your mailbox during the fall, you are bombarded with commercials promising massive bundles of free benefits. And they promise a $0 monthly premium, free dental charges, free cleaning, free eyeglasses, and even a preloaded debit card to buy your groceries. It sounds like an absolute no-brainer, but there are some reasons major insurance corporations are spending billions of dollars advertising these zero premium Medicare Advantage plans. They know that once you sign up, they control the purse strings to your health care. And every single day on these Medicare forms, healthy seniors who happily signed up for these zero premium plans hit a massive wall the moment they actually get sick. They find out the hard way that zero premium doesn't mean zero cost. Today, we're stripping away that slick marketing, looking directly at how these networks actually make their money and exposing the structural traps that could leave you stranded with high medical costs. To understand the core trap of this Medicare Advantage plan, you have to understand how the business model actually works. You see, when you enroll in your Advantage plan, also known as Medicare Part C, you're choosing to completely opt out of the federal government's Medicare system. See, the government pays these private insurance corporations a flat monthly fee to take over your care. And if the insurance company keeps you healthy, avoids paying for expenses and treatments, well, they get to keep all the excess profits. If you get sick and they approve every procedure, well, then they're going to start losing money because their business model relies on controlling costs. They restrict you to a real rigid local network of doctors and hospitals. And if you want to see a top-tier specialist across state lines or visit an out-of-network cancer hospital, your zero premium can legally be refused and you lose every single dime. Even when the network, the absolute maximum out-of-pocket spending limit is allowed by law, it's a staggering $9,250 in network care. So if you suffer a major health crisis, that free plan can quickly hand you a bill for thousands of dollars in hidden copays and co-insurances. But the network restriction is really only half of the battle. The most exhausting hurdle facing Medicare Advantage enrollees, that's the system of prior authorization. It slows everything down. And under original Medicare with a supplement, if your doctor says you need an MRI or a knee replacement or an expensive specialized medication, you just go and get it done. The federal government, they do not do the micromanaging that your doctor's really making the medical decision. Under private Medicare Advantage plans, the insurance company is acting as a middleman between you and your physician. Before an advanced screening or a specialized surgery or stay at an inpatient rehabilitation facility, your doctor has to submit a formal request to the insurance company's administrative review board. Now, recent data reveals that the largest Medicare Advantage carriers deny necessary post-acute care and rehabilitation requests at an incredibly high rate. These forces the patients to fight through months of stressful appeals just to get a treatment that their own doctor has recommended. And the final most dangerous trap of all is that the industry insiders call the Medigap a lock-in. Now, the insurance companies cannot look at your pre-existing conditions, your height, your weight or your prescriptions. They have to issue the policy at the standard rate. However, if you choose a zero premium Medicare Advantage plan instead, you only have a 1-year trial period to change your mind. If you stay on that Advantage plan for 2 or 3 or 5 years, and you suddenly develop a serious illness or a chronic condition, you cannot just casually switch back to a Medigap plan. In the vast majority of states, if you try to buy a supplement plan later in life, you must pass a full medical underwriting. The insurance companies will pull your medical records, review your diagnosis, and they can legally charge you astronomical rates or deny your application completely. This completely locks you into an Advantage network for the rest of your life. So, what's the takeaway? Medicare Advantage is not inherently evil, but it is a massive financial trade-off. If you're comfortable staying inside a local network, willing to navigate corporate administrative hurdles for approvals, and have a solid emergency fund to cover potential $9,000 out-of-pocket maximums, and the premium savings might just work for you. But if you want total medical freedom, the ability to see any doctor in America without an insurance bureaucrat signing off on it, and the security of knowing that your out-of-pocket costs are locked down, you need to look past the $0 market. Run the math on the traditional supplement plan, protect your long-term health flexibility, and don't trade your medical independence for a free grocery card. If you want my team to look at the exact provider network and the out-of-pocket limits in your specific county, click on that link below. Thank you for watching, and I'll see you on the next video.